Order 52-1, Senator Karen Nyamu.
Mr. Speaker, I rise pursuant to Standing Order 52-1 to make a statement on a matter of general topical concern regarding World Breast Cancer Awareness Month, the state of cancer disease in Kenya, and the challenges facing victims of this dangerous disease. Mr. Speaker, the month of October is a very important month in the global calendar of health and wellness, as it is the month dedicated to sensitizing and creating awareness about breast and other classes of cancer. The month marks the start of a global campaign to increase knowledge and support for people affected by the disease. Mr. Speaker, sir, allow me to share some shocking statistics about the state of cancer in Kenya as released by the National Cancer Institute of Kenya in the month of February 2023. Mr. Speaker, 70% of cancer cases are diagnosed at advanced stages. 2/3 of the victims diagnosed succumb to the disease. Only 23% of all cancer patients in the country have access to cancer management and treatment services, and on average, the country records 47,887 new cases annually, with 32,587 deaths annually, translating to 89 deaths every single day. Mr. Speaker, no doubt this disease is a great menace and a disaster to our nation, and if you are not infected, then definitely you are affected. None of us can claim to be safe or immune, as the disease is not a respecter of any person, gender, race, tribe, age, or even status in society. Mr. Speaker, despite huge investments in the health sector every year, the low number of oncologists in Kenya continues to derail the war against cancer. Records from the Kenya Medical Practitioners Database indicate that we only have about 100 oncologists in Kenya. They are expected to serve more than 50 million Kenyans, translating to an oncologist to patient ratio of 1:500,000. And this state of affairs is not only quite alarming, but it has also put immense pressure on the few available public health facilities, leading to so much interruption of treatment and long waiting periods for patients. Mr. Speaker, the situation is further exacerbated by the low intake of the National Hospital Insurance Fund, the NHIF cover, where only about 25% of eligible Kenyans have actively taken up the cover. It is also observed that other private covers have been frustrating cancer patients and declining to pay their bills as per the insurance contract, and this only makes a bad situation worse. Mr. Speaker, as we commemorate World Breast Cancer Awareness Month, I urge every Kenyan, starting with my colleagues in this House, to be champions of the war against cancer by ensuring that we get screened early enough and understand that cancer does not have to kill you. And let us all embrace the popular mantra, your health is your best wealth. Mr. Speaker, allow me to inform my fellow senators that during this month of October, my team at Karen Nyamu Foundation and I have partnered with Path Care Kenya Limited to conduct a medical camp to offer free cervical cancer screening and treatment in Nairobi County. I urge all women of Nairobi to come out in large numbers and take advantage of this golden opportunity. As I conclude, Mr. Speaker, there is great need to come up with specific legislation to address the myriad of challenges facing cancer patients in Kenya. As such, Mr. Speaker, I will be sponsoring a motion in this House to address, among other issues, the financial challenges experienced by cancer patients, with a view to increase allocations towards the purchase of modern cancer equipment, training more oncologists, and revisiting the National Action Plan on Cancer. I urge my colleague senators to support me through the motion when that time comes. I thank you, Mr. Speaker.